Intraoperative optical imaging, or IOI, is transforming how surgeons approach brain surgeries, particularly when removing tumors that are close to essential functional areas. This advanced imaging technique allows neurosurgeons to visualize brain activity directly on the surface of the brain, offering a level of precision that significantly enhances both safety and outcomes. To understand why this is so revolutionary, let's explore the science behind IOI, its real-time benefits during surgery, and what it could mean for the future of neurosurgery. The brain is an exceptionally active organ, consuming about 20% of the body's energy, despite making up only about 2% of its mass. This high energy demand requires a constant supply of oxygen-rich blood, especially when specific regions are activated during tasks like speaking, seeing, or moving. The link between neuronal, brain cell activity, and changes in blood flow and oxygen levels is known as neurovascular coupling. When neurons are active, they consume more oxygen, prompting an increase in local blood flow to replenish this oxygen. IOI takes advantage of these changes in blood flow and oxygenation. By using specialized cameras that can detect subtle shifts in light reflected from the brain's surface, IOI creates visual maps that highlight areas of increased activity. Different wavelengths of light are used to identify changes in two key parameters: cerebral blood volume, CBV, and levels of deoxygenated hemoglobin, HBr, each providing clues about which brain areas are active and how. During brain surgery, IOI can be employed to map functional areas in real time. Surgeons can stimulate various parts of the brain, either through touch, electrical impulses, or even speech tasks if the patient is awake. This stimulation activates the targeted brain region, resulting in increased CBV and HBr, which IOI detects. For instance, when surgeons stimulate the sensory area, they observe an increase in blood flow and oxygen consumption in the related brain region, making it visible on the IOI images. What makes IOI especially valuable is that it works directly in the operating room, right on the surface of the brain. Unlike other imaging methods like fMRI, which requires large equipment and only captures images before surgery, IOI is integrated with the surgical microscope, allowing for continuous monitoring and real-time feedback during the procedure. The primary advantage of IOI is its ability to create precise, individualized maps of brain function. This precision is crucial in tumor resections, especially when tumors are near areas that control vital functions such as speech, vision, or movement. Here are some key benefits IOI brings to neurosurgery. 1. Protecting critical brain functions. By accurately mapping the brain's functional areas, IOI helps surgeons avoid damaging regions responsible for essential activities. This approach is particularly important in patients undergoing surgery for tumors located near the sensory or motor cortex. 2. Tailoring surgery to each patient. No two brains are exactly alike. IOI allows surgeons to adjust their approach based on the unique functional layout of each patient's brain, rather than relying solely on generalized anatomical maps. This customization leads to better preservation of the patient's abilities and quality of life after surgery. 3. Enhancing decision-making in real time. Since IOI provides instant feedback on the brain's response to stimulation, surgeons can make on-the-spot decisions about how to proceed. If an area shows increased activity, signaling a critical function, the surgeon can adjust their plan to protect that region. This real-time adaptability is a game-changer, allowing for safer and more responsive surgeries. The use of IOI in neurosurgery is associated with improved outcomes. By preserving more of the brain's functional tissue, patients are likely to experience faster recovery times and retain a greater degree of their cognitive and physical abilities. This preservation is crucial not only for quality of life, but also for reducing the need for extensive post-operative rehabilitation. Moreover, IOI's detailed brain mapping capabilities can lower the risk of complications, such as paralysis or speech impairments, which sometimes occur when brain areas are inadvertently damaged during surgery. As more data emerges, we're likely to see IOI playing a central role in minimizing post-operative deficits and enhancing long-term outcomes for neurosurgical patients. The potential applications of IOI extend beyond tumor resection. As the technology evolves, we may see it applied to a range of neurological surgeries, such as epilepsy treatment, where identifying and preserving functional areas is equally crucial. Additionally, IOI could be beneficial in brain mapping for patients with traumatic brain injuries, stroke, or degenerative diseases. Its ability to visualize active brain regions without delay positions it as a versatile tool that could support various medical interventions. Researchers are also investigating ways to improve IOI's capabilities. For example, integrating multispectral imaging, which uses more than 2 wavelengths, could allow even finer distinctions between different types of brain activity. This refinement would enable an even clearer view of how various brain functions are organized, further enhancing surgical precision. Intraoperative optical imaging represents a leap forward in how brain surgeries are performed. By providing surgeons with a real-time map of brain activity, it allows for safer, more precise procedures that protect patients' essential functions. For patients, this means shorter recovery times, a reduced risk of neurological deficits, and an overall higher quality of life after surgery. As IOI technology advances and becomes more widely available, it promises to reshape the field of neurosurgery, making complex brain surgeries safer and more effective than ever before.